So welcome to this module on diverse responses and outcomes with Dr. Secil Ertorer, Assistant Professor of Sociology at Canisius College. Secil is a citizen of multiple countries in the world, originally from Turkey, and now residing in Canada and teaching in the United States. And she's going to talk to us today about various nations' responses and cultural responses to COVID-19. So, Secil, would you like to briefly introduce yourself?
Of course, yeah. Hi, Richard and everyone. Thanks for making me part of this. So, like you just mentioned, I'm originally from Turkey. I'm a Canadian citizen and I work in the States. I still live in Canada and travel back and forth, commute, so cross the borders, crazy person I am. And I am a sociologist. I did earn my PhD from University of Western Ontario in Canada. And then I did a postdoc at the same university at the Center for Research in Migration and Ethnic Relations. And after my postdoc, I worked at York University in Toronto for 3 years before accepting my position at Canisius. So since 2017, I've been teaching at Canisius College as Assistant Professor of Sociology.
And we're very happy to have you here. And I should also note that last year, Secil and I were the co-recipients of the Mission and Identity Grant for our work on the Borders and Migrations Initiative at Canisius College. So,
yeah.
And I think if not, we will include a link to that page as well, so that those interested in more issues on borders, immigrants, and migration can look at that page as well. So, Secil, I will turn it over to you to enlighten us.
Yeah, sure, of course. So as a sociologist, I will be looking at different responses, social, institutional, and state level responses to the COVID-19 pandemic. And I will not be focusing on specific countries, but instead, bringing examples from different countries. And when you talk about, nations and comparing the states, it's actually not that easy because there are lots of variables, right? So you cannot control. But as a sociologist, I'm going to look at some patterns we do realize and how we interpret these common patterns as a sociologist. So before doing that, and if you are a person like me who is like following the statistics on coronavirus cases every day, this is the website I use, Worldometers. They update the website every day and they gather data from all the countries around the world. From here, you can see the total cases, new cases, new deaths, and even how many tests are done in these various countries. So and if you click on one of the countries, you can also get more deeper information as to this specific country. As you can see, like right now, this is the total number of active cases in the United States, deaths, and how many people recovered. So like I said, you can go into the detailed statistics from this website. So I wanted to share with you in case you want to, follow every day what's happening. And also I wanted to show it to you because this is one of the statistical data set that one can find data from different countries all around the world. And when you just skim through it, you do realize that it's everywhere. Okay, COVID-19 is, this is why we call it a pandemic, right? It's not staying within borders, it's not contained. Every point in the world is exposed to it. So even like the communities in Brazil that don't have any social contact with the modern world, they have got the virus, right? So this is crazy, and this shows the extent of it, right? As you see, it's everywhere. And the interesting things when you look at this data is, when you look at the top countries, as everybody knows, USA is the epidemic center now, like much more cases than everywhere in the world. So one may say that, oh, okay, because it's a populated country, we have so many people. So if you actually look at that, you can also see on this table the population sizes. And US is not the most populated country in the world, okay? So it doesn't explain that. Sorry, just, yeah, it's too sensitive. I'm just going back to it. So it's, you know, yes, population and population size and population density are very important in explaining a contagious disease, right? If the region is densely populated, of course, it's natural that it's easier for the disease to spread easier, okay? But it's not the only variable. And it's not the countries that are overly populated, okay? There are lots of countries. If you look at this, India, the population size of India. So if you look at this, you would say India or China should be the epidemic center, right? So there are certainly other variables here, the other factors that define and determine, you know, why some countries are more affected than the others, right? Putting population size aside, right? Like I said, US is not the biggest population size in the world, but it has the total number of cases, and you know the difference is much bigger. And when you look at the list, you actually see lots of countries like developed and wealthy countries, the strongest countries in the world, like UK, Spain, Italy, you know, Germany. You see in the top of the list the countries that are so wealthy, which means that they have power, they have money, they have health infrastructure, you would assume, and you know they have the best medical teams and technologies, right? The best resources, one would assume. But the story is actually different. It's not that simple. And like if you look at the deaths per 1 million population, in the list you'll see San Marino, Belgium, UK, Spain, Italy. So my question is, so these wealthy countries, like most strongest countries in the world, have wealth, have money, have resources to fight a disease, have the best kind of medical devices and medical experts in the world. How come they are the epidemic centers, right? So what explains this? What are different when we compare these countries? So this slide talks about these things, like, you know, by looking at these statistics, like I said, you know, even though the northern countries and the western countries are not the biggest populations, the most of the world's death toll is coming from these countries like United States, Italy, Spain, France, United Kingdom, right? So most of the deaths due to COVID-19 is happening in the global north. So when the virus was hitting the south, everybody was saying that, okay, it's going to devastate these countries because they don't have anything, they don't have infrastructure. How are they going to deal with this? They don't have ventilators, hospitals, this or that. But it hasn't happened that way. I'm not saying nowhere. Okay, definitely there are countries that in the south that are hit harshly, like Brazil. Okay, but you know, when we think about this, the results, the outcomes are harsher in some of the Western developed world, right? So this also tells us a different story. It tells us that we also need to consider other factors. Okay, it's not about just, you know, how wealthy you are, or if you, whether you have the best you know, medical systems or experts or scientists in the world. There must be other factors, right? So otherwise, how do you explain that? Like the entire region of West Africa, which has the greater population than the US, recorded just 650 deaths, right? the death tolls are lower. And of course, I want everybody to keep in mind that we are just looking at the statistics that are submitted by the governments. And yes, this may not be purely reliable. Okay, we also need to always keep in mind that some countries are not sharing their data, especially about the death tolls, right? So I just want to let you know that I'm aware of this, but we are just able to interpret what we have, right? So, and this is the case for all countries, and even for the United States or Canada, we don't know, maybe there were other deaths resulted from corona, but it was not recorded that way. So it can apply to all countries in the world. Okay, so like I said, main factors will be definitely, it's about the population size, population density, and the demographic composition of the country. Like the reason Italy was affected and hit harshly by this virus is because it has an aged population. You know, it had the most oldest people living in Europe. So, and as we know, this virus is very dangerous for people who are older, who are elderly. So this is a factor we cannot control, right? The population size or the demographics of do you have a young population or old population? It's something we cannot control. But I want to talk about the other things that human beings can actually change and control, like the institutional and structural readiness of the societies, the political structure of the nation and the leadership in the country, which is very important, and the sense of community and solidarity in a society. And definitely early response was one of the important factors in controlling and containing the disease, and some early experiences with infectious diseases. Okay, so these are the factors I want to talk about and address, because again, these are the things one can control and societies that can control. So in regards to institutional and structural readiness, of course, this relates to so many factors, such as how does the economy run in the country? What is the political system? You know, is it a democracy? Is it totalitarian? And, you know, what is the ideology? Definitely how the states, the countries reacted and responded to this pandemic depends on these things. You know, so if you are living in a capitalist and neoliberal society, when you face a disease like this, or you know, any other issue that affects the health of your society, there is actually not so much that one can control, okay? Because the system is designed that way, because the economic structure is designed that way. What I'm meaning with this is that the healthcare system and the healthcare infrastructure depends on the political and economic context. So in a social welfare state or in a communist state, it is the responsibility of the government of the state to take care of the citizens. So the health and well-being of my citizens is my responsibility. So I'm in charge of everything about healthcare, you know, the testing, hospitals, giving them care, and isolation, quarantine, everything is my responsibility. And in a lot of countries in the world, you know, they do have a universal healthcare system, which means that there is one single payer. The government is controls the healthcare system, and usually it is the payer. And in some countries like the United States, the healthcare is private because, you know, due to the capitalist neoliberal economies, the government say that, okay, this is not my place, my role, I will just stay behind. The same as all other areas in an economy, health is one sector, So it will be run by the private sector. So there are so many multiple payers and multiple players, you know, different insurance companies, healthcare givers, service providers, this and that. So in a universal healthcare, the citizens, healthcare system, citizens do not pay into the system. So if you get sick, you know that the government covers it for the most part, especially, you know, there are differences in different countries, but universal healthcare system means that, especially if it's something about your health and if it's a serious disease, you don't need to worry about paying for it. It will be taken care of. Okay? So I live in Canada, and so I have been experiencing this in my life, like universal coverage. I have had 2 surgeries, even 3 surgeries. I have never seen a bill in my life. Okay. And then as soon as I started working in the United States, they started giving me so many forms, and they are explaining, this is for that, this card is for this, and I was given like 3 different cards for one health insurance. You use this for copay, you use this for this. I was like, it's so confusing. How many PhDs does it take to understand this thing? And you know, how much I'm gonna pay, how much my insurance is gonna cover, changes all the time. So it was like so complicated for me, because again, there are so many players in the system. There's no one person determining the prices, talking about, you know, setting the prices, services, and the standards. Everything is run by the free market, by the players in the free market economy. And the government, the federal government, has no role in it. Okay? In a universal healthcare system, the federal government has a role, has a say, has a control. So when this thing hit the countries, it was easier for the countries who has a universal healthcare system to plan and organize, because they are already, you know, one power, and they say that, okay, here is a problem. It is important, and it's about the healthcare sector, and this is what we are going to do. You plan, you organize, you set the rules. You say that, okay, we are going to need that number of extra hospitals. We are going to need that number of extra ventilators, this, that, okay? You make decisions, and then boom, boom, boom. But in a privatized neoliberal economy, it doesn't work that way, okay? In this economy, the hospitals, clinics, all providers, they have to work with the logic of efficiency. So normally, they have no spare capacity. They only have enough number of beds or medical devices or, you know, medications. And suddenly something extra happens. They are like, okay, you know, we don't have extra beds. We don't have extra ventilators. And even if we buy them now, after the pandemic, what are we going to do with this? So in the private mentality, everything is for profit. So if I'm not going to profit from it in the long term, why would I invest in it, right? And so this has happened in the United States. Lots of pharmaceutical companies also, they didn't even want to go in the efforts of developing a vaccine because they didn't see a profit, right? So there are so many players, and they are the decision makers, and there's no central governance in the healthcare system. When it's private, everything is about profit oriented. And if there's no profit, they don't do it, which means that, you know, even though there were signs of pandemic coming up, nobody wanted to invest in, just in case we see more patients coming, we need to invest in ventilators, more hospital beds, because they are like, what if we don't? So it will not be profitable for us. So they did not want to. So they were not prepared. Even though they knew that it was going to happen, they were not prepared for it. So when it comes to issues like, you know, tracing the people who has it, gathering data, you know, or adding surveillance systems and everything, you need more centralized programming, or even if there are different levels of organization and governance, you need people to get together and come on a consensus to take action as to what we need to do, right? But in a capitalist and neoliberal economy, it's so hard. Like I said, you know, everything is more profit-oriented, not community-oriented. Okay? And also community health infrastructure is very important, because in a lot of countries that are developing, not developed, industrialized, there are lots of community services, including community health services. Like when a need arises, the community workers gather together. You know, there are lots of community nurses, volunteers, some activist groups. They go around, they take the necessary trainings, and they go in the community to help the people in need, right? And also not always medical people. There are also, you know, traditional people who are traditionally trained in traditional medicine. They are also part of the health infrastructure in developing countries. And when a big pandemic like this occurs, and when there is so much burden on the modern medicine system, so these people can, and they have stepped in a lot of developing world countries to take over some burden and take up some role. Okay? So in those countries, we see the sense of community, people gathering together and saying that, okay, we also have a role. We are in this pandemic all together. We cannot just sit down here and wait for the people in the government to do something for us. Okay? And they already have this sense of community solidarity, and especially in the health area, like I said, a lot of developing countries have the community health network systems, and it helps, you know, instead of top-down government efforts, there's a horizontal information sharing and advice. And people do trust these people more than actually they do trust their governments, right? And some examples from the world, like in Malawi, in Zambia, people were quick to accept and implement the measures because they, like I said, there was this sense of solidarity. They are like, okay, these are people from my community and working and volunteering for my community. And if they have come to my door to inform me about this contagious disease, and if they're telling me that I should be wearing a mask, washing my hands, stay at home, I listen to them because I trust them. Okay? And we are a community, and this is my role in this. Like in Brazil, the community leaders, they took up the role for taking care of the vulnerable populations, you know, the people who are sick, the people who are the dead, you know, the communities organized, and they even organized to help economically for people who lost their jobs. You know, they did fundraisings and they helped them. So community organizing is very important, and something important is in developing countries, we see more sense of community and solidarity than the developed countries. In more industrialized and developed wealthy countries, people are more used to just waiting for the governments to act for them, to do something, to help. But in some countries, when you know the governments are not capable of helping, or they are not wealthy enough, people do help each other. It's about this sense of community, and it's about this cultural difference. You know, some societies are more individualistic, some are more collectivist. Of course, you know, we cannot just say that these people are individualistic or collectivist. It will be stereotyping, but it's a big, huge spectrum. And you can see some societies more closer to one of these sites in the world. And developing countries are more closer to the collectivist aspects. Again, it's not to say that some individuals in those societies are individualistic or liberal. It's not saying that, okay? But it just means that culturally, these people have the sense of community and solidarity, which means that we have to take action together, and I have a responsibility. It's like you know, in the Jesuits education, we don't keep talking about cura personalis, right? So yes, so, and it's about, you know, man and woman for others. So in these countries, this cura personalis is more prevalent, it's more there. You know, I take care of myself and I also take care of my neighbor. And it also affects, you know, how you follow the measures, because when people say that you have to stay home because it's about the health of our community, so in these societies, people are like, oh, okay, even though I feel healthy and I'm don't like being locked up, I have to do it for the others, right? In individualistic societies, people are like, no, I need to go and have my hair cut. Oh no, I want garden center supply. Oh, I want to be able to buy guns, right? So it's more individual needs. But in collectivist societies, it was easier to keep people at home, inside, because people have the sense, they have the sense of community, and they have the sense of social responsibility. Okay, this is my role, this is my part. And definitely the political structure and leadership in these countries are important. Like, because in a lot of countries, of course, it's not all peaceful. There are always opposing sides, groups, right? But the important thing is now there is an issue, a pandemic, a virus attacking your nation, right? So a lot of countries took united action. So they just left all the politics aside. They said that this is the common enemy now. We need to focus our energy on this instead of trying to attack each other. Okay? So different political groups, politicians, and also, you know, the scientists and experts, they united in some countries and they took action together. They said that, okay, we use science, we use scientific knowledge, and we are going to have an evidence-based policy. So scientific knowledge and our medical experts tell us we have to do the quarantine, do the tracing, this and that. So a lot of countries who followed this and took united action, they are doing better in this fight, like New Zealand, Australia, Vietnam, Singapore, South Korea, Senegal. You know, the countries who put things aside and started working together, they have done better. But in many countries, this has not happened. So still, there is lots of dissonance between different political groups, and this has become a topic, a subject in politics. You know, some people are downplaying the importance of the pandemic, the virus. Some are saying that, no, it's serious, we have to listen to the scientists. So in some countries, there is no one idea and agreement on what to do about it. And in these countries, it was harder. And especially if the country is like, has a big bureaucracy and there's leadership at multiple levels, and if these leaders cannot agree on how to take action, it's so hard, right? It's a mess. And in a lot of countries, we see this mess happening, and especially the, you know, European countries and United States is an example for that. And in some countries, we have seen like power grabs by using this. Especially countries in Eastern Europe, they use the pandemic as an excuse to gain more power in the politics. Oh, okay, this is state of emergency, thus I have more power. So, you know, yes, you can have more power to make decisions about the public health, but, you know, they did not limit it with the decisions on public health. Like it happened in Hungary, it happened also in the United States. They use the state of emergency for making decisions about taxing people, you know, passing some bills. So we have seen some power grabs by just using this as an excuse. And we have seen police harassment of their citizens. And some countries, they have been in denial. You know, they are like, okay, this is not serious, come on, it's just a flu. And we are seeing the results, like Brazil, UK, US, they were in denial for a long time. And even some gave unfounded medical device to their populations. And we are seeing the results for these countries. These countries are making the top at the list in regards to active cases and total number of deaths due to COVID-19, right? Because they were in denial for so long, and still some are. It's just two quotes I wanted to share to talk about, the politics and political structure, how it's important. So there are so many different political systems in the world. It doesn't matter whichever you are, but when you are faced with a pandemic, serious like this, you have to just unite and act together. So, just like this is no time for politics. The Conservative Party leader in Canada, Andrew Scheer, who keeps, talking about the Prime Minister Trudeau all the time, saying that, okay, he's not good, he's not capable, he's false, he's fraud and things like that. But at this time, he stopped all these things. And he said, okay, this is no time for politics. Okay, we have just one thing to focus on. Like an example from Senegal, we have managed to set politics aside and put solidarity and togetherness first, right? So we do see that countries who have grasped the importance of this are doing better in this fight with COVID-19. So this is why the political structure is important. It's not just about how the political system is, it's about, how they are managing their political system during the pandemic. And of course, some countries have shown early responses, and they are doing much better. With early measures, I mean closing the borders, barring entry from high-risk areas. And a lot of countries did that, but they did that in March, right? So some countries, smart countries who have seen it happening in China in December, they started taking measures as early as January. Like some examples, Senegal, Mongolia, Cook Islands, they closed the borders, they started contact tracing. They started setting up task forces. They prepared their healthcare systems for this. They established teams, they established field offices, they canceled all big events and gatherings, right, as early as January. And we see that these countries have seen the advantages of acting early, taking measures earlier. And these countries also started to think about their welfare packages and, setting a budget for this. So some of the countries gave cash money to people, saying that, okay, just don't go to work, don't go outside, we are going to cover this for you. And it's not just wealthy countries, even the countries, who are developing and who don't have much budget, they did that. At least what they did was waiving utility bills. They said that, okay, don't worry about rents, don't worry about paying your hydroelectricity bills, we will cover that, right? So all they were trying to do so in their own capacity. And again, this is also not that easy in a neoliberal capitalist economy, because nothing is run and owned by the government, right? So these are all the private corporations, and so you cannot tell them, okay, the way people's bills, right? So when everything is so privatized, then it's also hard to make these decisions because you don't own and you are not the decision maker in the field. And a lot of countries acted early in the response budgets, and in regards to putting aside money for people who are losing their jobs, but also setting aside money for improving their healthcare system and investing more in medical devices, and as well as doing research on COVID-19. Okay, Like in Canada, it took like a couple of days to approve a research funding for this. And, it was like the fastest approval of funding for scientific research, right? Some countries did act fast. And the media message is also important. They use their media to give the message about the importance and significance of this virus. And like some countries like Albania, they just dedicated one TV channel to COVID education, to educate people and to update people on a daily basis, right? And like in Canada, the Prime Minister Justin Trudeau, he keeps going and talking to the public with daily briefings. Every day he says, okay, he goes in front of cameras and he talks to the nation about, okay, this is what happened now, this is what we are planning to do next, so these are the packages we are planning for you, right? So they use media to prepare and to calm down their public. And some countries who had early experiences with infectious diseases, especially, not too early, sooner, like SARS in 2003, right? Because they are like historical but not too old experiences. You still remember that, you are still affected by it. So you are more prepared about these things. So the countries who have had experiences with HIV, Ebola, SARS, they were more anticipating a future epidemic to happen, and they were more prepared. And they also have learned from their former experiences. They knew that, more epidemics can happen. So they stockpiled, if they had the resources to do so, they stockpiled ventilators, PPE, some equipments, and they had the expertise and knowledge to deal with that. And I'm going to talk about this in a little bit. Some countries like United States, even though they had the experience and even though they did know a future epidemic was coming, did not take precautions. Okay, I will talk about this. So this is like from the yesterday's statistics, comparing cases in United States and in Canada. So as you see, this is a big, huge difference. But again, the population sizes are different in two countries, right? So this is cases per 1 million in population. So if you look at this is a more fair comparison than this one. Okay, so number of cases per 1 million population is over 6,000 in United States and over 2,000 in Canada. Still, when you control for the population size, this is a huge difference. And total deaths per 1 million population, again, this is a big difference, right? So I want to talk about, two North American wealthy and strong and powerful countries. In a lot of senses, they are both, democratic societies, both capitalist, neoliberal economies. How come they have some differing results? Okay, so these are just some graphs showing the number of cases in time in the United States, like, showing the increases and decreases in time. So we see in March, number of cases appearing and sudden increase. And as you see, there's a peak point around April, May, and you see some level of decrease, but still it's not a steady decrease. So you can see better on the linear scale here. You see after March, you see increase. And here you feel like, okay, it's gonna decrease, and then no, again, it's picking up, right? So when you look at this graph, it's not so, optimist, because it looks like it's again picking up, it's increasing again. Of course, in the upcoming days, we are gonna see, but this graph so far is not so promising. this is the one for Canada. Again, we see in March, number of cases starting and a sudden increase here. And this is also the time that they increase the number of tests, right? More tests, more results. And then as you see, there is a steady decrease. So every day Canada made the peak but started to decrease. It's able to control the numbers, and the numbers are decreasing every day. So why and how, even though they have some similar structures and they are in similar positions, they are at different places. So when we look at the national strategies and national level emergency measures, I mentioned the importance of, the politics, right? So in Canada, the Canadian provinces, they showed unified response and they coordinated their policies. In Canada, there are provinces and territories, right? But and there's the federal government, right? So they were all in consensus with the federal government that they had to take quick economic measures. They had to approve a pandemic budget, an aid package, and they said that, okay, we put politics aside, all other needs aside, and we are gonna work together. So this is the new biggest issue we have to deal with, okay? They unified, and they gave the public one message, not confusing, okay? Everybody is saying the same thing. It doesn't matter which party they are representing. They are all saying that the science and our medical experts are telling us that this is what we should do. And the chief health officer, Theresa Tam, every day she gave briefings to the public saying that this is the picture for today and this is what we are doing. So they made the medical experts the decision makers. So, and when the Canadian Prime Minister was on TV every day, he was just quoting the chief public health officers. He was saying that they say we have to do this, so we are doing this. So they kept giving reference to scientific knowledge and expertise, right? So on the other hand, in the United States, it was different. So so again, in the United States, there are different states and there is the federal government, right? But there was no unified message. So the states has differed in their responses and in their strategies. And there was this disagreement. They did not, agree that, this was one big problem and they had to act together. In Canadian provinces, they coordinated policies, they helped each other, they sent devices to each other. But in American states, it was more a conflict, like, okay, some are aligning with scientific knowledge and some are skeptic. They're like, it's like flu, it's nothing, come on, our economy is more important than that, right? So they put economy first. In Canada, this did not happen. Even though it is also a capitalist and neoliberal economy, they did not put economy first, right? So in America, we see partisanship and using COVID-19 as a subject for political arguments and more politicization. So now you have people believing that COVID-19 is serious and we have to follow scientific knowledge and take measures. And you have the other side saying that, no, it's just flu, what are you doing to us? You cannot restrict our liberties, our freedoms just because of flu. Right? So you have two opposing sides in the United States. In Canada, this has not happened, right? And the media messages, if you compare into the countries, so in the United States, there is still some, channels downplaying the importance of COVID-19, and instead of relying on scientific data, they are like, okay, they are trying to downplay and simplify it. But on the other hand, of course, there is some media using scientific knowledge and expertise and saying that, okay, this is what we should do. So people are confused in the United States. Like I said, you can find different sides and they are coming up with their own justifications. And it's another thing to divide the nation in the United States now, right? And also role modeling in the media. Like in Canada, this has not happened. Even like the CBC is not the greatest, medium. But for during this pandemic, they have been just relied on the scientific data and, the messages of experts, scientists and medical experts, okay? Also, role modeling is important. So whenever you see like everyday briefings, meetings, you see people are wearing masks, they are following the rules of social distancing. But in the United States, you have seen some politicians like saying that, okay, you don't need to wear a mask, or they kept shaking hands, which also happened in the UK, right? Their president was also like, okay, yeah, I still hug people, I still shake hands with people, and we have seen the result, right? So role modeling in the media is also important because people are following you and they are taking this message. In Canada, they were careful about these role models too. People did model social distancing. And the political culture, even though the two countries are similar, they are also different because yes, they are both capitalist neoliberal democracies, but Canada is more a democratic socialism, which means that it's a more of welfare state, right? So there is this sense of community, and as in other welfare states, Canada takes the responsibility when it comes to healthcare and education, big issues, right? And the federal government is also much bigger compared to the government in US. In the US, government is smaller, but in Canada, people are used to government being big and taking a role in different fields, especially when it comes to healthcare, right? And like I said, it is a welfare state, and it has been taking the healthcare system, the responsibility of the healthcare system for decades. So especially when it comes to a pandemic, they take up more roles, the federal government, and the provinces go with it. US is not a pure capitalism, but it is more capitalist compared to Canada. It's much less welfare state. Okay, the welfare programs are much less, even do not exist compared to other welfare states, right? So it's more a neoliberal economy and focuses more on the economy than the well-being of its citizens. In Canada, the universal free healthcare for everybody, for all citizens, did mean that when people did feel sick, they did not worry about paying for the testing, or they were not worried that if they would be hospitalized, they would bankrupt. But in the United States, this is the case, right? So it has the privatized healthcare system, which runs only for profit. And usually the most of the population is insured through employment. And there are still millions of people that are out of coverage, because even though there is Medicare and Medicaid for people who don't have coverage, it doesn't cover everybody. And there are still lots of people have no coverage. And even if you are covered and you have insurance, there's the copay. And if you are hospitalized, the bills are hard to estimate. Any medical care in the United States is too costly, and there are lots of cases of bankrupts. And if you think about this, if you get sick in the United States, you are less likely to go to the doctor, go to a hospital, because you are scared, you don't have the money, or you're afraid of being bankrupt. In Canada, this is not the case. So if you get sick, you don't even think about this. You just go and you get your treatment, right? And in regards to setting up screening centers, testing centers, isolating the COVID centers from the other hospitals, these things were easier in Canada because there's the central governments and central funding. So when the governance is central, they can say that, okay, we are going to keep these hospitals for only COVID patients, and we are going to set up extra hospitals or testing centers here, and we are going to keep these here. There is, people just follow with it because the money is coming from the government, right? But in the United States, it wasn't that easy for the reasons I said, because everything is privatized, everything is for profit, and people are like, okay, but we cannot do this. We can not think about losing money. How do you guarantee us you will pay us, we will make money? But, in Canada, this wasn't the issue because the government is already the payer in the system, right? And there are so many complexity in the US healthcare system. Like I said, there are so many different players at different levels. So it's so hard to make these decisions and take action, right? And because of this healthcare system in the United States, especially people of color are hit harsher because they don't have access to healthcare, or because of their types of employments. Because usually people of color are more likely to work in the jobs that expose people to more risky jobs. And this also reminds me, like when I was talking about other countries and what they did, like places like China, they have taken some rule measures, right? Social distancing, lockdown and everything. But there are Uyghurs in China, and they made Uyghurs still go to work and do all the work for them in the factories or in the fields, right? Also, there are these things happening, the ethnic discriminations. So even during COVID-19, these things still persist. Everything is not, every groups are not treated similarly, and COVID-19 has also been a case that to abuse this more, especially for ethnic groups. These people were put into risky jobs more than the others. And the identity. So the Canadian identity and American identity, more different. The Canadian Americans are more independent and more individual, right? And there is more mistrust in governance and also in science and scientific in the United States compared to Canadians. So Canadians have more sense of solidarity and community, and they are more unified. They are used to having a big government and government, intervening in issues, especially when it comes to healthcare. It is a social welfare state, so people are used to government taking up some roles, and people also do trust their governments because it's a social welfare state. Because they are like, I know that my government takes care of me when I get sick or when I lose my job. Right? And the Canadians are known to be more likely to follow the rules compared to Americans, right? And, more likely to refer to authority. And Canada also had an experience with SARS recently in 2002 and 2003. This was very important because after this experience, Canada actually has realized that they had some misdoings and some gaps in the healthcare system, public healthcare system, and they reformed the healthcare system and they ramped up the public health policy. Okay? And during SARS, Canadian federal government was criticized a lot about their healthcare systems. So after this, they have changed us, and they reformed the healthcare system, made the public health back, and started to collaborate with the provincial governments about all healthcare institutions in the society. And because they have had such an experience with SARS, they allocated a budget for future pandemics. But on the contrary, in the United States, what happened, even though there are, the Centers for Contagious Diseases, they had been doing studies, and they had been giving warnings to the government as to a future pandemic is coming at the door. The government did not care. They still cut back the budget from the healthcare system and even canceled the projects on contagious diseases, right? This was the biggest mistake. And also, like Navarro just said that as early as January, he, as the advisor of Trump, he said that, okay, this pandemic is serious. We are gonna lose lives. This is what we are supposed to do. We have to take it seriously. We have to, think about the budget. We have to buy PPE, this and that. But Trump did not listen. Instead, they passed a bill, still cutting down the money for funding for healthcare system. But they approved more money for the wall. So they were focused more on the wall than the healthcare system, even though pandemic was already happening in the world. And, he was informed about this. So he did not really take the scientific advice, right? So it was the opposite in America. And the pharma companies, they showed no interest in, working on contagious diseases because there's no profit, very low profit. They're like, oh, it's not my job. Somebody else take it. So, in conclusion, so there are differences and different outcomes in different countries of the world. So if we think about it, yes, cultures are different, the political systems, but sense of community identity, these are different in different countries. But what explains the difference in the death tolls? It's doing the work, the countries who did the work that needs to be done and who acted earlier than the others, they managed to contain it. Like look at Singapore, New Zealand, they have done a great job, right? They took it seriously, they listened to science, they asked medical experts about what to do, and they were very good in tracing the cases, isolated them, setting up their healthcare systems. They did the work. It's not by luck. It didn't happen by luck. They did the work to contain it. Yes, demographic factors are important and they are hard to control if you have a very aging population. Like most of the deaths in Canada have happened in the centers for elderly, right? So, when it hits the aging population, they are less likely to survive. You cannot control that, right? If you have an aging population, not much you can do. But you can control other factors in your society, right? You can listen to science, you can reform your healthcare system, reform your social welfare system, start taking care of your citizens, and create this trust. And instead of giving conflicting messages to people and trying to politicize them on this issue, just try to unite them and try to educate them. And just follow what the science tells you, right? So this is all I want to say. So these are the main resources you can use, and I especially suggest everybody, we are going to post this, everybody to watch this interview with Noam Chomsky, and he talks about Trump's responses to the pandemic.
Thank you, Secil, for this presentation. I just want to remind our listeners of some other modules that dovetail with this. We have a module from healthcare workers in the field and their perspectives on this that I think would be useful for our listeners and viewers to take a look at. Definitely. There's also 2 units on cholera. One is in Spanish. It's about the cholera epidemic in Puerto Rico in 1835, I think. And the other one is about the outbreak of cholera in England in 1832. How does that relate? It relates because of similar issues about community formation, community solidarity, or lack thereof, and the tension between economic interests versus social interests. And so lessons from the 19th century are still relevant today and show us that very little has changed in human behavior, that these debates are still going on. So I encourage our listeners to check out those. I also want to say that I'm hopeful that we will have a unit on Cuba's response to COVID-19. That'll likely be in Spanish, but in essence, Cuba managed to control it a lot because I mean, there are certain advantages, such as a very centralized government. It's an island, which makes the control of who comes in much more manageable. But, you know, Cuba, it's not a developed nation and has severe challenges when it comes to
finances,
resources in healthcare. I mean, they have a very good healthcare system. Everyone's covered.
Yeah.
The problem is there's not enough medicines. There's not enough equipment. But what Cuba does really well is they have a doctor for every sort of 1,000 person unit. So everyone has access to the doctors. The doctors always live in the community. They live next to their offices, and they do house calls for those who can't come in. So there's that sense, and a lot of sort of community and solidarity to address issues that, because of economic realities, the government is unable to address, right? Yeah. So I think that will be interesting for people to also, at least if you understand Spanish, to look at.
And also, sorry, Cuba has also sent all over the world their, doctors and medical equipment, even though, they don't have much. They did share what they have with the rest of the world, which also shows this culture and sense of community, right?
Exactly.
They did not keep it for themselves.
And that's what's interesting too, because Cuba considers that its biggest resource is its people. Mm-hmm. And if you look at people as your resource, then that changes the equation or the logic of efficiency, as you mentioned, right? It becomes our primary investment is in the people, and as a result, we can export that to other areas that need them. The
importance of culture, right?
Exactly. And a lot of this is culture shaped by the Cuban Revolution, of course, but I mean, it falls in line with how Cuba approached its literacy issue, with how it approached the AIDS crisis. Now, there is a lot of debate about how Cuba approached the AIDS crisis, but it did respond in a community fashion to that. It turned out not to necessarily be the best response in terms of understanding the disease initially, but it did mobilize as a society. So I think that's important to remember too.
Good point, yeah.
I have a couple questions for you. So in Canada, have there not been protests about reopening or protests for against the economic impact of closures, or anti-Asian protests?
So I will not say they have not, because it did happen once. Toronto, and in Toronto it did happen once, and it was a small group, and it did not happen again. And it was a very small group, and they didn't find support, right? So in Canada, there is not so much debate about reopening. A lot of people have accepted that we have to wait and for the scientific experts to say it's time to follow to stage 2, stage 3. It's just a minority of group, but they did not get the support, so they did not keep doing it, right? So it just did happen once, and they were not able to gather more people around them. So I guess that's why they did not do it again. And also, you know, doing this is also violation, because you more than 5 people cannot gather right now, so in public. So it did not happen, like, you know, the things happened in the United States, like if people even with their guns, they were out there, right? It's no, these things did never happen. In Canada, there is not so many people talking about opening the economy, but a lot of people are concerned about the vaccination when it comes out. Is it going to, you know, be enforced? You know, are you going to be told that if you don't get vaccinated, you cannot go back to work? You know, there are anti-vaccine movements happening, but not, you know, we are not seeing too many about movements around opening the economy fast.
And what about anti-Asian discrimination, which I think has died down in the States, but when it first appeared, there was
yeah, there have been cases. There have been cases reported in Chinatowns in Toronto and also in Vancouver. There have been cases. I will not say they did spread widely, but we did learn and hear about them. But the good thing is the media reporting these cases, you know, they were, nobody was supporting. So I think this is very important. When these people do not find supporters, and when they realize, you know, they cannot gather more people around to join them, they stop doing it, right? And how media portrays it is very important, because when we read these news from the media, you know, the media was never supportive of these things, right? Because it was always given like, okay, this is this doesn't follow with the Canadian identity. We are not this.
Another question, this goes back to one of your earlier slides about the statistics. I wonder, I understand that in your field, you can only operate on the statistics that you have available, right? Mm-hmm. And you did mention that there is certain problems with the accuracy of the numbers, but I'm curious because we know, so there's, part of the issue is some countries are testing more than others, either because of capacity or whatever. But also that there are countries and even within the United States, states that are misclassifying or underreporting or calling it pneumonia, that they're not, that the numbers aren't necessarily reflective of the true picture. And we saw this also in the AIDS epidemic as well, where people were dying from everything but HIV for different reasons. That was more out of social opprobrium rather than let's keep our numbers down. So I'm wondering what your sense is of the accuracy of these statistics in terms of deaths.
So in the field, people have been talking about this, right? But the problem is nobody says that, you know, they are so accurate, because the problem is at the country level. It's the country's decision to report or not to report. And a lot of countries do not want to report that because they don't want to look bad. They don't want people like me going out and saying that, okay, you did this wrong, right? So they have been changing. Like you said, the main thing is, first, it's about the testing. A lot of people are sick, but they are not tested. So how do we know if they did have COVID-19 or not? Right? So a lot of people just has it, they recover from it. And in a lot of countries, to get tested, you need to show symptoms, or you need to get in contact with people who had it, otherwise they don't test you, right? So there's no way of knowing if it was the case or not. So we don't know these people who never got tested. Also, we don't know for the real reasons for people, like you said, that, you know, on the death records, they just said pneumonia or something else. It doesn't say it's COVID-19. And I have read so many reports about different countries, like, you know, the directors, management of the hospitals are told not to report on the death records, not to write down COVID-19, right? It's the, you know, there have been lots of sayings about this and rumors about this, but we don't know, you know, to what extent we can rely on that. I have read that in Turkmenistan, you are not allowed to even talk about COVID-19. You know, not reporting, even if you mention it and you accept it, and if they say that we have 0 cases, but all around, you know, when you look at all their neighboring countries, they all have active cases, but they are saying that we don't. And if somebody says they do, they can be prisoned for saying so.
Oh my God, that's just...
It is crazy, and countries don't want that, because they don't want to they don't want that the other countries know that they are not able to deal with it. Also, they want to open for tourism, they want to open for economic relations, right? Because they don't want to scare other countries also for economic reasons.
Right.
Right.
So, I mean, I understand that presents a challenge in your field to try to be accurate in this.
It's a big challenge because we don't know if it's accurate, but on the other hand, we still talk about them because we don't know if it's accurate for the top countries there. Mm-hmm. You know, everybody says that in the United States, the cases are much more than what is reported. You know, same for UK, same for Spain. So everybody says that it's a case for all the countries. So we just keep it like, think about it as an error that applies to all countries.
Well, I guess that does make sense. You just assume that all the numbers are artificially low.
Yeah. And, you know, I will just tell you this here. You can also see how many tests per population the countries do. So you can sort from here. So the countries who did most tests for 1 million population: Monaco, Gibraltar, United Arab Emirates, Cayman Islands. You can see who is doing the most testing. And the interesting thing about it is when you look at that, when they do more tests, the total number of cases are lower, especially new active cases are lower, and especially death totals are lower usually. Mm-hmm. Because in some countries they are doing the testing only when it gets serious, but in some countries they are doing it as a preventative measure. You know, they test people so to make sure and to isolate and quarantine people who has them, right? So again, it's not most of the tests are not done in the countries who has the most cases, right? Because when you look at the total cases, the countries change, right? Even though these countries have the most cases, they are not the ones doing the most of the tests.
It's also interesting.
It's not due to the number of tests. You know, America is not the top because they do the most of the tests. It's not.
You need to explain that to our president. It's also interesting that in the tab of tests per 1 million, I think that was the tab that you did.
Yeah.
Most of those countries are very small and with very secure borders, either geographically or for other reasons.
Yeah, especially Monaco, Gibraltar, yeah.
So I know that I have a tendency to ask predictive questions, and that's not your field, but I wonder if you have given any thought to, or if there's any evidence of a shift in American culture in response to the fractures and failures evident in our healthcare system to make the American population more willing to consider universal health care, whether this experience is sufficient to change the discourse around that.
So I haven't seen a study about this yet, but my own observations is, and also maybe my hope is, people have realized how important universal healthcare is now. Because people, when they don't need it, they don't think about it, right? Because in my classes, we always talk about the healthcare system, and the only students who come out and talk about it is who are affected by the system, who cannot afford to buy their puffs, or what is the...
They're inhalers.
Yeah, inhalers, because you have to carry them and they are too expensive, right? Or, you have some disease that you have to regularly visit the doctor, or you have a regular medication. Only these students come out and speak in my classes because they have had the experience. They're affected by it. They're like, yeah, it's so bad. I'm having hard time with this. It's so hard to afford that, blah, blah. But the other students do not know of it because they don't, they haven't been there. And then when they hear people going bankrupt for, having a surgery in the hospital, they're like, how come? But you have insurance. No, insurance doesn't cover everything, right? Everybody assumes that insurance is the solution. As long as you have insurance, you're covered. It's not. So you bring them evidence and you show them how much one operation costs in an American hospital compared to in a Turkish hospital or a Canadian hospital, and they are shocked. They're like, how come the same thing costs like more than 5 times more in America, right? Because there's no government control, so the pharmaceutical companies or hospitals, they just charge anything they want, right? So they don't know it. So with this epidemic, I'm thinking more people will engage with the public health system. And even if they don't directly engage, now they had to think about, okay, if I go for testing, how much I will pay. So they had to think about, oh, if I get hospitalized, how much it's going to cost. So this made people that this is a reality and this can be my reality, So I'm thinking this is going to wake up some of the populations to this reality. It is serious. It is big.
I certainly hope so, because everyone that I have talked to who has either been a victim of COVID or who works in the healthcare system, they all agree that we have a serious problem, that we just don't seem to have the political will to deal with in an effective way. So I hope that this shifts the conversation.
Because everybody has made to believe that if they agree to public health care system, they are going to have to end up paying lots of taxes. Mm-hmm. And then I asked them, do you know the taxes you pay, you're paying for what? Where does the money go? Do you know? They're like, I don't know. I'm like, do you prefer that money to go to military, or do you prefer that money to go into the healthcare system? Just look it up, mm-hmm. right? So the ideology has given people this assumption that, oh, okay, you will be paying for everybody's healthcare, but you don't even know what you are already paying for, right? Mm-hmm. You just take it and you're like, oh, okay, I don't want to pay much, but just analyze. You're going to pay how much more and for what? In Canada, nobody ever questions that they are paying more taxes because of the healthcare system, because of the ideology, because they were told that they have to pay for taking care of the others, right? So they never question that. The same way in America, when you grow up in America, you don't question why don't I put money in the healthcare. Here, they're like, oh, why I put in it, or why not. You are just raised up with this ideology. You don't even analyze it. You just accept it. So there needs to be a wake-up call for people to analyze it.
No, definitely. I certainly hope that we in the United States find the capacity to adjust our perspective in terms of healthcare.
Yeah. And like I mentioned, even though Canada has always been more social welfare state and always had the universal healthcare system, it wasn't working as efficiently before the 2003 epidemic. So, they did learn from the experience. So hopefully, United States is going to learn from this experience. Hopefully.
Right.
Yeah.
Well, Secil, thank you very much for this very interesting talk. And I hope that sooner rather than later, you can cross the border again, or vice versa, and we can see each other in person.
Exactly. I hope so. Yeah. And thank you so much for inviting me to this and making me part of this. I'm looking forward to checking other modules too. There are so many interesting topics, and there's also so much I want to learn about, like the Spanish flu and everything, because with this pandemic, I have also realized I don't know too much about our historic pandemics and plagues, right? Yeah.
That's why it was so fascinating. The talks on cholera were just amazing to me. Somewhat disappointing because I feel like not much has changed in the 180 years in between.
This is disheartening, right?
That part's disheartening, yeah.
Yeah, it's sad.